There's a lot of very interesting science and clinical research ongoing in ovarian cancer, not just PARP. There are other targets that are, I think, of great interest in early phase development. But PARP is a little bit more mature, and I would be shocked if a PARP inhibitor wasn't approved for use within about 2 years. So, as you may know, this was developed with a lot of very elegant laboratory work done primarily in the UK, but some in this country also, some laboratories in this country, which demonstrated that PARP is a protein that repairs single-strand breaks in DNA, and it's absolutely critical in cells that are missing BRCA1 or 2. If you inhibit PARP in those cells, they will develop double-stranded breaks, and that's a catastrophe for the cell. And so it created this scenario of what's called synthetic lethality, which was sort of coined by scientists in this country about 40 years ago in a completely different system, but exploited by Alan Ashworth over at the UK. So, and he created this whole class of drugs called PARP inhibitors, which should be selectively effective in tumor cells from patients who have mutations in BRCA1 and 2. So that was the excitement. You can demonstrate in the laboratory wonderfully. It transitioned to into the clinic very quickly. And then it went through a number of fits and stops. There were some, I think, drug development mistakes. They kept shifting the endpoints, the kinds of trials. And at one point, about 2 years ago, we were all disappointed because a number of the companies said they are not going to develop PARP inhibitors. And just in the last 2 years, that's all changed. And now at least 3 major companies are rushing towards randomized phase 3 registration trials using PARP inhibitors in ovarian cancer.